Good evening, everyone. On behalf of Caregiver Saathi, I extend a very, very warm welcome to all the listeners who are tuned in for today's program. Today is Doctor's Day, and for us at Caregiver Saathi, there is no better way than to celebrate it with someone from the fraternity. I was admitted with COVID a few months back, and of the many things that COVID leaves behind, one memory that stayed with me was of the vulnerability of the young doctors posted in the COVID ward. And with that thought, we at Caregiver Saathi have started this series, which we call Humanizing Our Healers. And it gives me immense pleasure to welcome one such healer here today. Umme, welcome. On behalf of Caregiver Saathi, I extend you a very, very warm and hearty welcome. And thank you. Talk a little about yourself for the sake of our viewers.
Thank you so much to Caregiver Saathi for organizing this, and to you, Ma'am Vandana, for inviting me to speak in the first episode of this Humanizing Our Healers series that you've begun. Thank you so much for having me. A quick intro about myself. I am Umme H. Faisal. I passed my MBBS and completed my internship this year in February. I'm currently working in a COVID ICU in Kolkata. And apart from that, apart from being a doctor, I'm also an avid reader. I write threads on medical history. Those of you who follow me on Twitter would probably be knowing. And yes, that's about me.
Thank you so much, Umme. And I follow you on Twitter, and I know what lovely threads you write about medical history. Totally in awe of that. So for the viewers, we all know how difficult the last 1.5 years has been for everyone, for the humanity. It's been brutal. The number of lives lost, it's unimaginable. But for our doctors who've been in the thick of it, taking care of sick people, it's been an Herculean task. They have gone beyond their line of duty to take care of people, saving lives. And we call them our superheroes. Fair. Why not? I get all goose flesh when I say this. But a point that I want to raise here is they are superheroes. And the cape that they wear, isn't it on the shoulders of a vulnerable human being? With that, Umme, I want to know how the last 1.5 years has been for you.
A little bit of a backstory. So when my internship began last year in February 2020, it was also the time when COVID cases began appearing in India. So I wouldn't be wrong to say that I was amongst this first batch of interns who were just inducted into medical training and were thrown into a pandemic. To be very honest, it was terrifying. And I remember that I was posted in ID Beliaghata Hospital, which is the infectious diseases center for West Bengal. And, we were the part of the team that helped isolate the first couple of cases of COVID-19 in the entire state, for that matter. So I remember being petrified. I was just so scared of going to work. And, before each shift, I used to get these little panic attacks where I couldn't sleep at night. But, and I think it had a lot to do with the fact that we had no medical exposure, no training as such. We just began internship, 1 week into internship, and boom, there's a pandemic. So having said that, I feel that the past 1.5 years have been very, very instrumental in shaping me and my batchmates to be the kind of doctors that we've become now. Because, it was baptism by fire, like people like to call it. And definitely, it did take a toll on my mental health. It did make my imposter syndrome come out louder than it would have, I think, come out under normal circumstances. But I think everything happens for good. And maybe 20 years from now, when I'm an old academician, I can talk to a batch of young junior doctors and tell them, hey, I was an intern when the COVID-19 pandemic happened.
And you can tell them that you actually walked through fire to make it to where you are.
I hope
So
so.
yeah, thank you for sharing that, Umme, and also for the viewers who are listening to this. While I'm talking to Umme, I get all these goose flesh and shiver up my spine as a young person thrown into the middle of a pandemic so acute. I mean, it's just unimaginable the amount of pressure these young doctors have taken. Umme, with the responsibility come in a lot of challenges also, and with at a young age, tender age that you are at, managing those challenges would have been a huge task. Can you talk us through that? Because I know a lot of doctors have carried vicarious grief with them, and so would you like to elaborate a little on that?
Yes, I think, the grief that I felt as a healthcare worker can be broadly classified into two categories. The first being vicarious grief, and the second being anticipatory grief. So every time a patient passed away and I wrote the death certificate and I handed it over to the patient's family, I was so disturbed by the fact that I couldn't do more. I couldn't save the patient. I'm pretty sure with experience, people learn to let go. People learn to understand that not everyone can be saved, no matter how sincere your intentions are. But I've had a lot of trouble accepting this because, in some way, I felt that I was being inefficient. And I went through a phase, I think 2 months ago, when I was in total burnout, and it was very difficult because we Kolkata was going through its peak second wave, and during that time, I used to feel like I was going to duty just to write death certificates. It definitely took a toll on me. I used to wake up at night to the sound of the ventilator beeping as a patient was coding, and when I woke up, I just realized that I was in my hostel room and it was just a nightmare. So grief did affect me in that way. So, and again, there was anticipatory grief where I was anticipating that something bad would happen to my family. My mom lives far away from me, does not live with me, so I was always very scared that what if she gets COVID, and what if something happens to her in the small tiny hometown that I come from, where we don't even have adequate ICU facilities and where I am definitely not there to take care of. So every time a middle-aged patient, someone of my mother's age, passed away in front of my eyes, it reminded me about my mother. So yeah, it has been difficult, but I mean, I've had tremendous support from people around me. So I think I've been able to overcome that.
um, I'm choking on emotions when you share this as a young person to be thrown right in the middle of it. And I remember from our previous conversations that you had mentioned that on the second day you had to sign a death certificate, and nobody prepared you for it. And how heavy it must have been for you, Ume, that time. So I'm totally. What should I say? I'm in so much gratitude for what you do, for what you have been, and also just grateful for people like you who just add this beautiful extra bit to humanity. In addition to the challenges that you have spoken about, there were also lack of resources with so many patients coming in, and at times, when the caregivers of those patients questioned you and the resources were not there, how did you tackle that?
Um, I think initially, when I was faced with both circumstances, it was very difficult for me to uh, handle those situations properly. But the thing about medicine is a lot of what you do is what you learn on the job. as time progressed, I think I became a little better at dealing with patients. And what I've realized is, a lot of us lack when it comes to communicating with patients. And communication is always a barrier because we are never trained as doctors in order to empathize with patients. We're just taught about the disease or a syndrome, but we somehow I'm too young to be saying this, but I would still like to reiterate this fact that we somehow tend to overlook that this disease is in a person. It's not a disease we're dealing with, it's a person we're dealing with. So I feel that this understanding that I got from my seniors, it did not just come to me out of nowhere. I observed my seniors who were phenomenal doctors, very empathetic human beings. And I feel this leading by example and this understanding that they showed has been my guiding light as far as interacting with patients is concerned.
So well said, Ume, really well said. Also, for the viewers who are, who here listening to our conversation, what Ume said, does it resonate with you? She is as much human as you and I are, and as a human being, she's managed much more than you and I have. So let's remember today that our doctors are human beings too. They're superheroes, no doubt, but they are humans too. And let's hold these wonderful humans close to our heart. Ume, um, now I want to know about any regrets, if you had, about being in this profession at any point. I mean, seeing so much pain, anguish, death, despair. Did you at any point feel?
I always used to think that medicine was my calling. I always thought that. But then there were times in the past 1 year when I saw my colleagues get physically assaulted in front of my eyes. And when, not a single day passes when you do not see doctors being assaulted by a mob, or I mean, it breaks my heart. And when I see these instances, I have often reconsidered my choice. I often think that, is it really my calling? But again, that's the beauty of medicine. No sooner do I have this doubt in my mind than something happens in my career or my interaction with my patients that again reminds me that why I chose this in the first place. Like day before yesterday, I was very upset because of something that happened at work. A patient party was not behaving properly. I was very upset about it. But then I was just sulking over this fact, and then just like some sort of divine intervention, there was another patient party that called me up and they told me that they were really grateful for doing everything that I could do. And I think it's just this delicate balance of the negatives and the positives that every doctor goes through in medicine. So yes, I've had my second thoughts, definitely, but medicine has always brought me back to what I want in life.
And aren't we glad that you're a doctor? Even with the second thoughts, you come back to doing what you are doing now, Ume. So really, really grateful for you. Grateful for you for being in medicine. We need doctors like you with so much of empathy and love for their patients. Ume, I'm a mental health professional, and what has, say, ever since the pandemic came in, and most importantly ever since I was admitted, something that has bothered me and stayed with me is the impact of being in the COVID wards, the emotional impact of it. So have you felt, you did mention a few minutes back that there were times when you were emotionally very distraught, but would you like to talk about that, the impact on your mental health, Ume?
Uh, yes, although I did have a very nice support system, like my family is very close knit. I have wonderful friends who've always supported me, both online and offline. But it got to a point where, like I said in the very beginning, the imposter syndrome is always there. And I when the peak of second wave was going on, I went through a mental breakdown because I thought that people were dying because I was not good at what I was doing. And it was a difficult time for me because, and not just me, if when I looked at my team, we were all so sad and depressed. And that's also when I decided to go and seek therapy, because I realized that just taking antidepressants would probably not be enough. So it's had a tremendous impact on my mental health. But again, I have overcome that phase, or I'm in the process of overcoming that phase, because I have amazing peer support, and I have been fortunate enough to find good psychiatrists and therapists. So yes, I think that answers your question.
Thank you so much for talking about that, Umme. It's so important for everyone to understand this, that the kind of stress and the kind of workload these young doctors have taken on themselves has affected them in ways that we cannot even imagine. And as a doctor, she sought help because she knows she deserves better, she deserves to heal. So, this is a very important lesson for everyone who's hearing, and also for the doctors. If at some point you felt that everything is getting very overwhelming, it's a good idea to go seek help. And what did you do to de stress away? I know you were. I know you were on Twitter, and it's such a blessing to have you on Twitter. But were there other things also that you did to de-stress?
So my coping mechanism from a very young age has been reading, and so I read. I know, as absurd as it sounds, I used to come back from very long, like say 30-hour shifts, and read, because that's the only way that I felt at ease. Um, and I did not read a lot of heavy books. I used to read Mallory Tars and Nancy Drew, books that reminded me of my school days, because somehow when I read those books, I felt like I was back in my convent, just having a nice time with no worries about the future, living with my mother. So that's what I used to do. And I still do read a lot, but my reading habits change significantly when I'm stressed. When I'm stressed, I read Noddy and fun light books like that.
And not the enchanted wood and the I remember during my time I was a when, very avid reader, and my go-to books would be the Enchanted Woods, the faraway tree where people grew wings and went into a land where nothing bothered them. So yeah, so books are a great way to de-stress. um, Ume, what message would you like to give out to the people who are listening to this conversation?
So I would just like to say one thing, given that today is Doctors' Day, and I've been flooded with Happy Doctors' Day messages since morning. I really, really appreciate the sentiments, but I would also like to request you to please not put us on a pedestal. Stand next to us, and just be our companion. And I would also like to emphasize on the fact that healthcare is not something that is solely influenced by doctors. Healthcare is always a team effort of so many people, not just doctors and nurses and people who are directly involved in hospital care. It's a combined effort of people who make the legislations, the rules, the government that gives the money for these infrastructures to be built. So healthcare is always a combined effort. And as we know, our country has a lot of, I think the pandemic has just exposed all the loopholes that we had. So I think your anger towards just the doctors and nurses who are working on the front line is not very justified, and you should try to understand where we are coming from and how we want to help, but we are limited by the scarcity of the resources that we have at our disposal.
Thank you for raising that point, Ume. And, a lot of people have realized this in India, that this pandemic has actually exposed the underbelly of our healthcare system, how unprepared we were, how the lack of resources not only affected the patients, but it actually tied the hands of our doctors. The doctors wanted to save lives, but they couldn't because the resources were not there. And I do hope, for the sake of the doctors and for the sake of our country, we are looking at some major healthcare reforms in the years to come, because that will not only enable our patients, but enable our doctors also to look after our patients the way they deserve to be looked after. So, Umme, you are here with us as my first speaker. And for the viewers, why Ume? Because there's something about Ume. Honestly, I mean, I've been following her on Twitter, and the first time I followed her on Twitter and I read her posts, tweets, there was something that just struck me. And when we started formulating this program, Ume's name was the first one to come up. And I'm so grateful when I did reach out to her via message on Twitter. She immediately accepted. Not once did she say that I'm going to think about it. So yeah, so grateful and so glad to have you here. Ume, your views about our conversations, humanizing the healers.
I think it's a brilliant narrative, and I think what really, mm, you know, what I really like about this is the fact that you're calling in young doctors like myself and making us speak about what we go through. No offense, but I do feel like the narrative in healthcare has for a very long time been dominated by senior doctors. And what we, the younger doctors, and have to say is not often heard. And this is also a way of making people know that we are very young at what we do, and we genuinely want to help, but sometimes just because of the fact that we are young, we're not able to probably reach out to you in the right way. And I hope people will listen to these conversations and understand that we just might be somebody's daughter or someone's sister or someone's son for that matter. And this entire concept of humanizing seems very nice to me, because I am really, irked by the fact that people kind of tend to look at doctors as some sort of a different species of humans altogether, and and people are not really able to accept the fact that we might also make mistakes. So I think the entire concept of humanizing also brings into focus the fact that because we're humans, mistakes can happen.
Yeah, and it's okay. Absolutely okay. Ume, I also wanted to talk about what we discussed in our prior conversations before getting online, that the amount of workload that you've had in the hospitals, the OPDs are totally packed with patients. And please do touch a little on that, because people need to know that as human and as a doctor, how many patients do you see in a day?
So I did my internship in Arjikar Medical College and Hospital, and it's one of the busiest hospitals in Kolkata. Even during the lockdown, when I used to move around the campus at 2 a.m. in the morning, because I was on duty at that point of time, and I used to see that people were lining up in order to, attend an OPD that would begin at 10 a.m. And this is something that I understand that, doctors are very much overworked. But from a patient's point of view, I'm very irked by the fact that there's so much of health disparity in our country that people have to literally skip a day's meal or skip their sleep and line up for hours at a stretch for a simple OPD consultation that will probably take 5 minutes or less than that. So I do understand where a lot of doctors like myself are coming from when they say that we see around 150 patients in a day. No doctor should be seeing 150 patients in a day. But the point is, we do. And although it may be my 150th patient of that day, but I'm the first doctor for that patient who's come from so far away, having probably spent all his or her money on an ambulance. So this is something that has always irked me, not so much when I was a student, but when I began working as an intern, it began. This disparity was way too loud for me to ignore.
And Ume has raised such an important point here about one is about the disparity, the second is about the number of patients the doctors see and attend to. Can you imagine we get tired talking to 10 people in a day, and these doctors are attending to 100, patients in a day? How much of a emotional, physical drain it is on them. So it is not easy being a doctor in India at all. And let's all together applaud what they do and give them that space to be sometimes, because they also hurt, they also want to be happy, they also want to dance just like everybody else, and they also want a little time to themselves. They are not due, there's no law that tells them that they have to be there all the time, but these doctors have been there every time there's a patient in distress. So let's applaud them and be grateful for doctors like these. And Ume, we've talked of a lot of heavy stuff. And as we draw towards the end of this conversation, how about sharing some happy moments? I mean, happy or quirky, or maybe just light-hearted moments in your busy, chaotic, and overwhelming schedule.
I have one one funny instance to recollect. I think I have a lot actually. This is number one on my list. So one time in ICU, there was this old lady who was recovering and she was about to get discharged. And then one fine day, she's just like, in Bengali, she's like, "Are you married?" And I'm like, "No, I'm not." And then she just goes on to say that, I have a grandson who's your age. How about you? I just connect the two of you. I think I was really sweet of her, but yeah, that's one memory I will look back at fondly, although funny. And there have been countless instances where patients have brought me guavas from their tree at home, and there was one old lady. I remember I was posted in um, ophthalmology, and my job was just to check the visual acuity of the patient. I was not even doing traditional doctor stuff. I was just checking her visual acuity. She came in on one day, I checked her visual acuity, and then the next day she comes and she gives me 6 bananas. And I am like, what just happened? And she told me that I spoke to her nicely. That's why she wanted to give me bananas. She brought it from her village. And I have never felt so good in my life. And it was just very nice. So these small things that patients do for us that make us feel very, very grateful to be doing what we are doing.
Absolutely, Ume. And also, I want you to touch a little upon how the critical patients, your interactions with the critical patients.
So, I have this habit of when I go for rounds, no, even if the patient is on a ventilator, unable to talk, I don't know why I have this habit of asking each patient, calling them by the name, and asking them, "How are you doing?" So, there was one old lady who was she was like disoriented, and then uh, she began calling me Baisakhi. And I was like, why is she calling me Baisakhi? And later I got to know her daughter's name was Baisakhi. But I obviously did not object, because I mean, if she's calling me Baisakhi, she's probably associating me with someone else she knows. And if that lets her trust me in the ICU to be able to, do what I want to do for her treatment, then so be it. So that these are the kind of interactions I have with patients. And when you care for patients, you realize that they're not just a bed number. They are their idiosyncrasies. Like, so I used to look at my seniors and I used to think that how do they remember everything about a patient? But now that I am working in the wards, I realize that if you tell me bed number 26, I remember it's the old gentleman who always reads an English newspaper, or it's that old child. Sorry, is the young child who's not going to let anybody but a doctor who gets him chocolates cannulate his veins. Or it's this old lady who just shouts at everyone except one doctor who's her absolute favorite. So people are much more than just their bed number or their vitals, as we like to look at them. They are their idiosyncrasies. They are human beings. And just like you would probably remember me because of my history threads, and I am going to remember my patients because of one quirky thing they did. And that's that sums pretty much about what my interactions are like.
How heartwarming is that, Ume? My heart is filled with so much love, and just yeah, it just enveloped in love after listening to that. And also, this is what gives that special place for a patient to heal and develop that trust with the doctor, a doctor who can connect to the patients emotionally, can help actually ease so much of the patient's discomfort and pain. Thank you for being that, Dr. Ume. And with that, we actually come to the close of our conversation. And all I want to say on behalf of Caregiver Saathi, every member of Caregiver Saathi, is that we are so grateful to have doctors like Ume with us. And for me and our entire team, we wish her the very best in everything in her life. May she continue touching the lives of people in such beautiful ways. May she grow in leaps and bounds. And may love and prosperity be in her life always.
Thank you.
Stay blessed, Ume, and lots of love to you.
Thank you so much.
Thank you. Bye-bye, Ume. Thank you for being here with us.